Welcome Dr. Sateesh Kathula to Vastavam Health Hour. Sateesh garu, before talking about lung cancer, please give a brief introduction about yourself to Vastavam viewers.
Hello viewers, my name is Dr. Sateesh Kathula. I'm a hematologist and oncologist. I've been practicing oncology in Dayton, Ohio for the last 20 years or so. And I'm a clinical professor at Wright State University in Dayton, Ohio. And I've been in Dayton for the last 25 years. I did my training here, then I joined a group. And I've been working here as an oncologist for almost 20 years. So that's my introduction.
What are the common symptoms of lung cancer, sir? Can you please give us a few details about that?
Sure. Lung cancer can present with cough, shortness of breath, coughing up of blood, losing weight unintentionally, fatigue, and sometimes if it metastasizes to some places like to the brain or other places like bones, then people have symptoms like headaches, seizures, or bone pain. But sometimes they may not have any symptoms and it can be just detected incidentally. I've seen many cases like that too.
Okay, so basically what causes lung cancer in a healthy man, if you talk about a healthy person?
So any cancer is basically due to genetic mutations, and the mutations are caused by a number of things. In lung cancer, most commonly it is smoking. Mostly, more than 70-80% of the patients who have lung cancer have smoking history. Some cancers are very strongly associated with smoking, and some of them are not as much. For example, small cell lung carcinoma, it's a type of lung cancer, squamous cell lung carcinoma, and these two are very much associated with smoking, and we rarely see any patients who did not smoke to have these. There are certain other type of cancers, such as adenocarcinoma, which does not have too much association with smoking, but most of the adenocarcinoma patients are smokers though. I should say the most common cancer in non-smokers is what is called adenocarcinoma. Yes, non-smokers can get it too. There are other risk factors other than smoking, such as exposure to radiation therapy. If somebody received any radiation to their chest, for example, we see patients who are cured from Hodgkin's disease, who receive radiation to the chest area, and they develop lung cancer over a period of years. And then something called asbestos, who worked in asbestos factories and shipyards and things like that. And they are prone to get lung cancer called mesothelioma, which is due to asbestos exposure. It's a type of lung cancer, mesothelioma. And sometimes it can be due to radon, which is present in the basements. That also is a risk factor. There is a slight preponderance for family history. If you have a first-degree relative who has lung cancer, there is slightly increased risk of lung cancer in the offspring. So that's another risk factor. And chronic lung diseases such as fibrosis, for example, scarring of the lungs of some sort. It could be from tuberculosis, it could be from chronic smoking, COPD, or there is something called idiopathic pulmonary fibrosis. All these things can cause lung cancer. These are all the risk factors. And there's also a theory that diet low in fruits and vegetables can cause lung cancer too. And of course, pollution, for example, in developing countries, countries like India and other countries where there's a lot of pollution, for example, China and all that. I mean, we are seeing increased incidence of lung cancer because of pollution, because of the carbon monoxide, and all these things that are in the in the air. If there is a lot of pollution, then people tend to get lung cancers due to that. So the pollution is one of the main risk factors nowadays. Even though they don't have any smoking history, any of these can cause lung cancer. And there is one study which actually showed eating or taking excess B6 and B12 vitamins also is associated with slightly increased risk of lung cancer. We don't know the mechanism. It was only seen in men, but not in women. But this is something that we never expected. But so people who take excess B6 and B12, they might be predisposed to have lung cancers. And then people who have HIV or other type of immunosuppression can also get lung cancer more than others. And autoimmune diseases such as rheumatoid arthritis, systemic lupus erythematosus, they also increase the risk of lung cancer because of a deranged immune mechanism. So these are all the risk factors. So if somebody comes to us and they give history of smoking, it's very easy. We can blame it on smoking. But there are some people who come to us without obvious, smoking, obvious risk factors, and then we don't know what really caused. But any of these things can do that. And some people are exposed to all these things without knowing. For example, radon, which is present in basements, especially old basements, and they don't even know how much they're exposed to, and that can actually cause lung cancer. So not all the time we can pinpoint and say, hey, this is what caused lung cancer in your case. But majority of the times we can say that we can find a risk factor.
So that's very interesting, Dr. Sateesh. So smoking causes lung cancer, that is okay. So they can stop smoking. But all other factors you just explained, so people have to be very careful.
That's right. And smoking is, of course, the biggest risk factor for lung cancer. So smoking, I call it a weapon of mass destruction, and it can really damage your lungs, and it can cause so many other problems like increased incidence of heart attacks, strokes, and not only lung cancer but also others like esophagus. It can increase the risk of cervical carcinoma. It can increase the risk of bladder cancer, kidney cancer, and things like that. So smoking can cause many cancers and many other diseases other than cancer. So that's one thing, but definitely we all have to be aware of other risk factors. Like I mentioned, it's important that we pay attention to those things. For example, those who live in basements should be actually checking their radon levels, which can be checked pretty easily. You can call some agencies which can come and check the basement to see whether anybody has increased amount of radon in their basement. So they can also get rid of radon by using different machines and things like that. So those are all the things that one should be aware of.
Yeah, very valuable information, Dr. Sateesh. Many people are not aware of these things. So when we say lung cancer, we first think of the smoking.
Right.
Understand.
Also,
Thank you,
the
sir.
number of cigarettes people smoke is also important. It's not only the number, but at what age they start is important too. Second hand smoking also has a risk. Second hand smoking, what I mean by that is if somebody is inhaling right next to them. Right. We are seeing a lot of people whose parents and grandparents smoked in their home.
Right.
But they were exposed to passive smoking, and they come to us after many years, and they say, we have never smoked, but it is because of the passive smoking or secondhand smoking, people get lung cancer. So that's also an important thing. And the number of cigarettes they smoke and the age at which they started, as I said, is an important thing. And if somebody stops smoking, the risk goes down pretty significantly over a period of years. It doesn't go down immediately, but 10 to 15 years, the risk can be reduced by 50 to 90%. But still, there is a risk even if you cut down after smoking for many years. Even if you cut down, and it can come down the road, and we have seen that many times. And it can decrease the risk up to 80 to 90% in 20 to 30 years, but it never goes to zero. But it does cut down the risk substantially, and it's better late than never to stop it if somebody's smoking.
Okay, so even if you stop smoking, it will take few years to reduce that risk.
That's
of
right, but you have to
lung
start
cancer.
somewhere though. If you cannot stop today, and then when are you going to stop? If you continue to smoke, that's even higher risk, right, to get the lung cancer. Yeah.
So how long it takes to develop that, sir? Say, for example, a smoker. So he smokes at the age of 20 years, say for example. So how long it takes to develop that
That's
lung
a good
cancer?
question. People have to smoke for at least 20 to 30 years to increase their risk, and then also it depends on other risk factors. For example, if they were exposed to passive smoking, or if they have other risk factors, like I mentioned, if they're exposed to radon in their basements, or if they are taking diet which is low in B6, B12 vitamins, and if they have any family history, all these things matter. So it depends on the individual, but definitely it's not overnight. It takes 10 to 20 years at least to develop lung cancer.
Okay. So how it can be diagnosed? Like a chest X-ray can show the lung
It
cancer?
can, but chest X-rays are not so sensitive, and we can miss small ones, which can be potentially curable. Chest X-rays are not so great, but there are some modality. If there is anything, I mean, people used to follow up with chest X-rays, and we are not doing them anymore. And now we detect with CAT scans, and basically patients present with symptoms, and then we do a CAT scan of the chest. And if the CAT scan shows something, if it is biopsyable from outside, we can put a needle under CT guidance with CT scan assistance. We can go in and take a piece of that. The other modalities of diagnosis would include going inside the airways, such as bronchoscopy, what we call, and then going into the airways and then taking samples of the tumor if we see something there. There are improved techniques nowadays that we do, like navigational bronchoscopy or robotic bronchoscopy, where the bronchoscopy is put inside, and we can maneuver that like a video game, and then get to that spot where it is shown on the CT and get samples from there. So it is very sleek type of procedure. It increases the accuracy of the diagnosis, and these are all the things that we do to diagnose the lung cancer. So first thing is diagnosis, and the next thing is staging. And how do we stage that? We do what is called EBUS. It's called endobronchial ultrasound, where the ultrasound probe is sent through the bronchial tubes, airway tubes, with bronchoscopy. And then we examine the mediastinum, which is the space in between the lungs, and then take samples of these lymph nodes, if there are any lymph nodes that are present in that area. So those are all the things. And then we do PET scan to really know whether this lung cancer has gone elsewhere outside of the lungs, for example, liver, bones, or brain, things like that. Or sometimes most of the times we do MRI of the brain to actually look into the brain to see whether one has metastatic disease, meaning spread of the disease to the brain. So these are all the staging procedures we do, because it is very important in the treatment, whether we do surgery or chemotherapy or radiation, all these things. So that's why these are all the procedures that have to be done before we start the treatment.
So if a person sees those symptoms, as you explained before, so it is advisable for him to go for a CAT scan and make sure that it's not lung cancer. Is that correct, sir?
Yes. Common things are common. If somebody has some cough, it's not necessarily lung cancer. We all get common colds and other things, other infections, either bacterial or viral infections, and those are main reasons for cough. And even allergies, as simple as allergies, can cause cough. But if the symptoms are persistent, if they last for more than 2 weeks, then you have to seek medical help, and we have to do some scans and things like that. Sometimes you also have to look at the risk factors. If somebody is young, like 30 to 35 years of age, if they don't have any smoking history, any family history, or any other risk factors, we don't have to do any CAT scan. We can just empirically treat them for allergies or bronchitis, or depending upon the symptoms. But if you have risk factors, yes, and if the cough is persistent, then we have to investigate further with CAT scans and such.
Okay, sir. Is there any age group, like this age group or more?
Cancer, any cancer, not only lung, but any cancer is higher in patients who are older, and people, I should say, because age is a big risk factor. It's one of the biggest risk factors, because as we grow older, our genes are modified, and they undergo a lot of mutations. And we are exposed to so many things environmentally, or it could be just a degeneration of your DNA, which may lead to many mutations, and those mutations can cause cancer. So definitely, patients who are older are at increased risk of cancers, not only lung, but other cancers as well.
Okay, Dr. Sateesh, are there any ways to prevent this lung cancer? Just not by stopping the smoking?
Yeah, as you said, smoking is a big thing. Lifestyle modification is very important, which is the big thing is smoking, as you said. But other things include a good lifestyle, maintenance. For example, eating right diet, increased vegetables, increased fruit, exercising, and avoiding pollution as much as we can, and checking our basements for radon if they're old, like 15 or 20 years older. And if you have any risk factors like asbestos exposure or something like that, if you have HIV, then you have to be vigilant about lung cancer and other cancers too with HIV, because they're prone to get many more cancers with that. So those are all the things: diet, exercise, and then vigilant about the symptoms, and knowing the risk factors and proceeding accordingly. Yeah.
Okay, so how is it treated, sir? Is there cure for this lung cancer?
Yes, if it is detected early, lung cancer can potentially be curable. For example, stage 1, stage 2 patients, even stage 3 patients can be cured. And I have several stage 3 patients who have been cured because, the less of the stage, the more chance of cure one has. For example, stage 1, the 5-year survival with the treatment is about 60 to 70%. And that is cure, 60 to 70% chance of cure if your lung cancer is like stage 1. But as stage 2, the cure rate is about 50% if it is treated. But if it is not treated, then it can go to higher stage, and there is definitely increased risk of dying. But yes, it is curable, but we have to detect early on. So how do we treat these patients? If somebody comes with stage 1 or stage 2, we do surgery first. Surgery is the treatment of choice, followed by adjuvant treatment. That is additional treatment. For example, especially for stage 2 patients, we give chemotherapy to prevent the recurrence. So stage 2 patients, after it is taken out, the cancer tumor, then they are still at increased risk of getting this in future. As I said, 50% of the patients do develop, lung cancer again, or the same cancer can be elsewhere, and we are not able to detect that with, blood tests or the scans or anything like that. There could be microscopic disease. So our goal is to kill those microscopic cells. It's called adjuvant treatment with chemotherapy, and that's how we can prevent the cancer coming back. So that can actually reduce it by about 15%, adjuvant chemotherapy. For example, there are several studies which have shown that. And as I said, if you don't treat, 50% chance of coming back, but if you treat, there's only 35% chance of coming back. So we can cure 65% of the patients if you do surgery and give chemotherapy for stage 2 patients. For most of the stage 1 patients, you don't need any chemotherapy. All you need is surgery. And sometimes when people cannot undergo surgery because of their age, because of other medical problems they have, we can actually give focused radiation called stereotactic radiation. That can actually cure a lot of patients, like up to 60 to 70% of the patients can be cured with that type of radiation. And when it comes to stage 3, we give chemotherapy radiation upfront, and then we do surgery later on. So that's how the lung cancer is treated. For stage 4, there is no surgery required, but people get chemotherapy. And now we have new treatment called immunotherapy. It's not new anymore. We have been doing that for the last 4 or 5 years. And even without chemo, some patients can be treated with immunotherapy alone. But most of the times we are giving chemotherapy combined with immunotherapy. Both of them are IV. Chemotherapy has a bad reputation because of a lot of side effects, including hair loss, nausea, vomiting, mouth sores, and low blood counts, infections. The chemotherapy has a lot of side effects. Whereas immunotherapy is much better tolerated, but it has its own side effects. It's not 100% safe, but definitely better than chemotherapy. And then the other part we have is targeted treatments. And those are oral medications, people who have mutations such as EGFR, EML-ALK, ROS mutation, and NTRK mutation. Those are all the things, BRAF, these are all the things, those are particular mutations we see on these cancer cells. And those can be treated with oral medications. Those are called targeted treatments. So this the treatment works at the level of genes which are mutated and leaving normal cells alone. So that's how the side effects are minimal when compared to chemotherapy. But not everybody has these mutations. Only 15% of them do have these mutations. If you take 100 patients with lung cancer, only 15 of them have these mutations, and those can be treated with oral medications. And the efficacy of that is really good. Even with stage 4 disease, patients can live up to 3 to 5 years with those treatments. So that's about the treatments in a nutshell for lung cancer.
Oh, that's nice. So there are so many ways to treat that, and it's very, that's good to know, it's curable.
Yes, I mean, stage 4 is not curable. But again, stage 4, it depends on the scenario. If somebody has a small lung nodule, and if they have only one brain metastasis, they both can be removed, and that's potentially curable. If they have only one lesion in the other lung, both of them can be removed, and that can be potentially curable. But typically, in stage 4 is not curable. Stage 3 is much less curable than stage 1 and stage 2. But yeah, there are a lot of treatments available. And in the last 4 or 5 years, there is plethora of treatments in lung cancer field. And we have been using all of them with good success. There are stage 4 patients who we have treated in our practice who have lived for 7 years, 8 years, but that's not common. I don't want to give any false hopes or impression to people, but it is possible that patients can live longer even with stage 4 disease, but technically it's not curable. Stage 1, 2 are curable. Stage 3 is much less curable.
Okay. Sir, once we start the treatment, so depending on the stage, how long it takes to completely cure lung cancer?
Well, it depends. It takes a while. I mean, typically we give treatments for 6 months. If it is adjuvant treatment, like stage 1, stage 2, or even stage 3, we give about 4 months of treatment. If it is stage 4, we give up to a year or 2, based on their response, based on their performance status and things like that. Yeah, there is no set time for stage 4. It's more of an art than science to treat stage 4 patients. But stage 3, stage 1, 2, we have set number of cycles, anywhere from 4 to 6 months of treatment we give. Okay.
So once that lung cancer is cured, is there any guarantee that you won't get it again? If you don't smoke?
Well, a cure means that it's not going to come back most likely. Cure is a term we use. If cancer doesn't come back in 5 years, then the chance of coming back is much lower. And if somebody survives for more than 5 years, we call it a cure. That is the definition of cure. But can it come back after 5 years? Yes. Is it common? No. It's much less common than if it happens within 5 years. So after 5 years, it's not common. It's rare.
Okay. So that's very, very valuable information, Dr. Kathula garu. So thanks a lot for your time with Vastavam viewers today.
Well, thank you very much for having me. It's a pleasure to talk anytime about these things which are helpful for viewers. So thank you so much.